Hello, I'm Dr. Anthony Colantonio for We Do Patients Right, and this video is about pregnancy and how to make your pregnancy as healthy as possible for you and your baby. Getting pregnant and becoming a mother can be a very scary and complex time in a woman's life. The links on our website will help you learn what you can do before, during, and after your pregnancy to give your baby a healthy start to life and to make your pregnancy as pleasant, memorable, and as easy as possible. Pregnancy lasts about 40 weeks, counting from the first day of your last menstrual cycle. The weeks are grouped into 3 time periods, also called trimesters. We have a great deal of information on prenatal care and prenatal tests. You will find information on many topics by searching our website. You will find information on health insurance, and we also provide a fact sheet for pregnancy. We also provide fact sheets for choosing a prenatal care provider, choosing places to deliver your baby, what prenatal checkups you should have, how to monitor your baby's activity, what prenatal tests you should have, what defines if your pregnancy is a high-risk pregnancy, and how to pay for prenatal care. Medical checkups and screening tests help keep you and your baby stay healthy during pregnancy. This is called prenatal care. It also involves education and counseling about how to handle different aspects of your pregnancy. During your visits, your doctor may discuss many issues such as healthy eating and physical activity, screening tests you might need, and what to expect during labor and delivery. The body changes and discomforts that you might expect include body aches, breast changes, constipation, dizziness, fatigue and sleep problems, heartburn and indigestion, hemorrhoids, itching, leg cramps, morning sickness, nasal problems, numb or tingling hands, stretch marks and other skin changes, swelling and bloating, urinary frequency and leaking, and varicose veins. Let's take a moment to briefly review the 3 trimesters of pregnancy. The first trimester goes from week 1 to week 12. During the first trimester, your body undergoes many changes. Hormonal changes affect almost every organ system in your body. These changes can trigger symptoms even in the very first weeks of pregnancy, and these changes may include extreme tiredness, tender, swollen breasts, and your nipples might also become harder. You might have an upset stomach with or without vomiting, also known as morning sickness. You may have cravings or distaste for certain foods. You may have mood swings or constipation, which is trouble going to the bathroom and having bowel movements. You may need to pass urine more often, or you might get headaches, heartburn, or have weight gain or weight loss. As your body changes, you might need to make changes to your daily routine, such as going to bed earlier or eating frequent small meals. Fortunately, most of these discomforts will go away as your pregnancy progresses, and some women might not feel any discomfort at all. If you have been pregnant before, you might feel differently this time around. Just as each woman is different, so is each pregnancy different. For many women, body image is a concern during pregnancy. Learn what you can do to accept and love your pregnant body in our Pregnancy and Body Image section by clicking on our links. The second trimester goes from week 13 to week 28. Most women find the second trimester of pregnancy easier than the first, but it is just as important to stay informed about your pregnancy during these months. You might notice that symptoms like nausea and fatigue are going away, but other new, more noticeable changes to your body are now happening. Your belly will expand as the baby continues to grow, and before this trimester is over, you will feel your baby beginning to move. As your body changes to make room for your growing baby, you may have body aches such as back, abdomen, groin, or thigh pain. Stretch marks begin to develop on your abdomen, breasts, thighs, or buttocks. There will be a darkening of the skin around your nipples, and a dark line will begin to appear on the skin running from your belly button to the top of your pubic hairline. Patches of darker skin, usually over your cheeks, forehead, nose, or upper lip, may also begin to appear. You may develop numbness or tingling of the hands or itching on the abdomen, palms, and soles of your feet. The swelling of your ankles, fingers, and face might become more prominent. The third trimester goes from week 29 to week 40. You're in the home stretch, and some of the same discomforts you had in your second trimester might continue. Plus, many women find breathing difficult and notice they have to go to the bathroom even more often. This is because the baby is getting bigger and is putting more pressure on your internal organs like your urinary bladder. But don't worry, your baby is fine and these problems will lessen once you give birth. Some new body changes you might notice in the third trimester include shortness of breath, heartburn, swelling of the ankles, fingers, and face. And if you notice any sudden or extreme swelling, or if you gain a lot of weight very quickly, call your doctor right away. This could be a sign of preeclampsia, and you can find more detailed information on preeclampsia and other pregnancy-related medical problems by navigating the links on our website. You might develop hemorrhoids, which may cause pain or bleeding when you go to the bathroom. Your breasts will become tender and may leak a watery pre-milk liquid called colostrum. Your belly button may stick out, and you might have trouble sleeping. You will feel the baby dropping or moving lower in your abdomen, and you might feel contractions, which can be a sign of real or false labor. As you near your due date, your cervix, which is at the end of the birth canal, becomes thinner and softer, which is called effacing. This is a normal, natural process that helps the birth canal to open during birthing process. Your doctor will check your progress with an internal examination as you near your due date. This is a very exciting and a very stressful time as the final countdown to delivering your baby has begun. Of course, like any medical condition, there may be pregnancy complications, and the more you know about those complications, and the more you know about the warning signs of those complications, the easier it will be to avoid those complications. Our website provides information on health problems before pregnancy, pregnancy-related medical problems, infections during pregnancy, and when to call the doctor. Complications of pregnancy are health problems that occur during pregnancy and/or during childbirth. They can involve the mother's health, the baby's health, or both. Some women have health problems before they become pregnant that could lead to complications. Other problems arise during the pregnancy and/or during childbirth. Keep in mind that whether a complication is common or rare, there are many ways to manage problems that come up during pregnancy or childbirth. Our website offers information for families on how to avoid pregnancy-related medical problems and where to find help if and when you develop a pregnancy-related medical problem or medical problems during childbirth. We also provide information for women and moms and advice on where to look for additional help and advice. Our website provides information about the National Center for Birth Defects and Developmental Disabilities, where you can learn the signs and symptoms of birth defects and developmental disabilities, and then you'll be able to act early. We provide information on planning to get pregnant, getting ready for your baby, and for childbirth. Before you get pregnant, we provide tables and forms on basal body temperature, ovulation and a due date calendar, a preconception health quiz, and what to expect at a preconception medical visit. When you are pregnant, we provide information on pregnancy do's and don'ts, pregnancy food don'ts, and a pregnancy know-how quiz. And we even provide information on how to sign up to receive free text messages each week you are pregnant, timed to your due date or your baby's date of birth. When you're getting ready for your baby, we provide a baby wish list and a hospital packing list. For childbirth and beyond, we provide information on babysitting, breastfeeding, child care, returning to work, and when to call your baby's doctor. Your pregnancy is a complex medical condition and requires a great deal of planning before, during, and after your pregnancy and childbirth. For more information on pregnancy and childbirth, please navigate through our links on this website and call me for advice and suggestions. If you have a medical problem, or you or your baby has been injured during pregnancy or during childbirth, and you need advice on what to do next or where to go for help, please call me. The toll-free number is 855-832-5757. The call is free. The advice is free. Just call the number and be sure to ask for me. Ask for Dr. C. Thank you very much.